In your experience, your own personal experience with research you've done and your work as a pathologist, are you familiar with the issue that breast cancers may be more difficult to detect in heavier women?
Yes.
Now, would a gynecological cancer have shown up in any of the tests they performed at this time?
No.
What do we know about what the brain scan and bone scan showed?
We don't.
Let's go to June 9th. It says Dr. Shearer, 6:30 p.m. Is Dr. Shearer a surgeon?
Yes, he is.
And do we have any records from Dr. Shearer?
We don't.
No, actually, may we approach? Sure.
This should be in
Journal. Yep, just in journal. Thank you, Debbie. Just a quick 5-minute stretch break. All right, you need to step in back to focus and recess for 5 minutes. Everyone.
Okay.
course, absolutely, doctor. You may take your seat.
Thank you, Your Honor.
All right, let's bring the jurors back in. Thank you so much.
Jurors enter.
Welcome back, everyone. Thank you all so much. And we're going to continue with direct examination.
Thank you, Your Honor.
All right, thank you.
May I please report?
Yes, thank you.
Jurors? Where we left off, Dr. Robb was talking about Dr. Shearer, who's the surgeon. Now, what's the most likely reason at this point in time, given your knowledge and experience of the diagnostic process, for Mrs. Adamson to go see a surgeon at this point?
That she's a possibility to have surgery to remove a tumor.
And your experience with Mrs. Adamson had been consulting a surgeon if they had found cancer on the brain or bone scan.
Still possibly could, but probably not for curative purposes.
Based on what we know from the depositions and the calendars, at this point in time, does it appear that Mrs. Adamson's doctors thought they could perform surgery to cure or remove the cancer?
Potentially not cure, but definitely that they could remove a cancer.
Based on your education, training, and experience, were Mrs. Adamson's doctors, based on the information they had at that time, likely treating her for what they believed to be primary lung cancer?
I think so.
Do we have information from the calendar about Mrs. Adamson undergoing radiation therapy in the last few weeks in June, or middle of June into the last few weeks?
Yes.
From the testimony in the Rhode Island records, do we have information that Mrs. Adamson was receiving radiation at this time to shrink the tumor before surgery?
Yes.
And is that consistent with your understanding of typical procedure before surgery on a lung mass?
For a primary tumor, yes.
Now, up to this point in time, do we have any clear picture of what doctor or doctors are directing Mrs. Adamson's care?
Not specifically, no.
So then let's go to August 3rd. What does this entry say?
It says biopsy on leg, surgery postponed.
Is this consistent with Ms. Coughlin's testimony in her deposition that her sister found a lump on her groin, it was biopsied, and as a result, surgery was postponed.
It's consistent, although the leg is different than the groin.
Do we have any record of who the pathologist was who would have interpreted this biopsy?
No, we don't.
Do we know what pathologist or radiologist or surgeon took the biopsy?
We don't.
Do we know whether it was the same pathologist who interpreted this biopsy as her prior biopsy from her lung?
No, we don't.
Do we know what, if anything, the pathologist had who was interpreting this biopsy as far as a history?
We don't know.
Do we know what the results of this biopsy were?
Not based on the calendar right here.
Do we have other information in the records that we know what the results potentially were?
Well, it looks like from the Rhode Island records that she was reported to have a perineal cancer, or CA, which would mean cancer.
And so does that match up with this notation from August 3rd and the deposition testimony from Christine Coughlin about a second cancer being found?
Yes.
Why would you postpone surgery after cancer is found in a new location?
Well, it could reflect widely metastatic cancer from either the lung or possibly from another site.
Do we have some notations in the Rhode Island records that talk about where the biopsy was taken and what it showed?
Well, the biopsy of this area, it showed what they just wrote as CA or showed as cancer.
And so you said the perineal area.
Yes.
Did we bring a body diagram for you to use to help explain to the jury where cancer was found in Mrs. Adamson's body?
Yes.
Would you like to, may I approach Your Honor?
Sure, of course.
Would it be helpful for you?
Sure, that's fine.
Would it be helpful for you in explaining to the jury where cancer was found in Mrs. Adamson's body for you to come down off the stand and use this chart or the diagram?
Sure. May I?
Yes, of course.
Then I'll hand you these markers.
Okay.
First, Dr. Robb, before we get into the second cancer that was found, could you please demonstrate for the jury or mark for the jury where the cancer, at least from what the information we know, was found in Mrs. Adamson's lungs back in May?
Well, these are the right and left lungs right here, these little pink things here. And so the information from the Rhode Island records would indicate she had at least had a right upper lobe mass, which would be, that's the upper lobe of the right lung.
Could you please, Dr. Robb, mark for the jury and explain what the perineal area is that was referenced in Mrs. Adamson's medical records?
The perineum is the area that's located down here between the legs, and it encompasses the area around the rectum as well as the area around the vagina. So it would be in this area right here. You would be looking up, it would be all the way back to the rectum and front towards the vagina.
Based on the fact that Mrs. Adamson felt the lump herself that was ultimately biopsied, where specifically do you think the cancer was in the perineal area?
We just know that it would be probably here or deeper into the tissue as well, but we don't know the full extent of where the tumor may have been.
From your experience and from what you know from the records and the depositions, are you thinking that this is a skin cancer in the perineal area?
Well, it either could be a skin cancer or it could be a metastasis to the skin region. And perineal cancers are actually not that common primary, but tumors can metastasize there, and this could be tumors that are in the local area here, or it could be from distant sites.
And you know what, you actually pointed out that I asked a bad question. I guess more of my question was, is your belief based on the information we have about her actually feeling the lump, that the cancer was on the skin in the perineal area?
Well, we don't know because usually lumps are deeper into the body than the skin. Then it would be like a little nodule on the skin, but a lump usually refers to soft tissue swelling.
Okay. Now, did you see any later materials noting a concern about, by the doctors about a concern of a mass on her forearms?
Yes. I think it was right. I forgot specifically which side.
Well, you don't have to mark it right now, but
I think she also had a soft tissue, if I could look at it. What it sounded like a mass on, I think, one of the forearms, and I think it was right.
I think you're right. Well, can adenocarcinomas metastasize to the skin?
Yes.
Which ones?
Well, all adenocarcinomas can metastasize to the skin, from lungs to adenocarcinomas that arise in the colon or the higher up in the GI tract or from the gynecologic tract. All those could metastasize there.
Do gynecologic and breast cancers more often metastasize to the skin than other adenocarcinomas?
The more common sites would be, yes, breast, gynecologic tract, and melanoma.
Now, I want you to assume that Ms. Coughlin testified that it was her understanding that the cancer metastasized to the lymph nodes in the groin area. Where would that be located? Is that different from the perineal area?
Well, some people confuse them, so it's difficult to say specifically. But the lymph nodes in the groin run kind of right along this chain here, and they're adjacent deeper to these vessels that are present here, so that the red is an artery, the blue is a vein. So they tend to lie along this area here, and the extent may be down to the perineum, but we don't know if they meant that area or higher up in a lymph node.
So based on the information that we have, could Mrs. Adamson have had cancer in the perineal area, those lymph nodes in the groin area, or both?
That's true, she could.
Had Mrs. Adamson's doctors done any type of workup prior to this date to identify a cancer in this area?
Not that I know of.
Does primary lung cancer typically go to the perineal area?
It's unusual.
In all of your years of practice, your thousands of cases you've seen, have you ever seen the perineal area as the first site of metastasis for a primary lung cancer?
I have not.
Where does cancer go first if it spreads from a lung primary?
Well, it can go to different areas, but it often goes centrally to the hilum here, or it can, if it's a peripheral tumor, it can go outwards into the pleura, and then it can move through the lymph chain, up and down, and also up here, and then down this way.
So are the mediastinal and hilar lymph nodes in the middle of the chest typically the first site of metastases for a primary lung cancer?
Yes.
Would Mrs. Adamson's doctors have been able to identify cancer in that area based on the chest X-ray and chest CT scan that she had gotten done previously?
They may have, yes.
I mean, chest CT scans will typically identify mediastinal and hilar lymphadenopathy, right?
Yes.
Cystine.
Sure. Is it true that typically CT scans will identify cancer in this area?
Yes. They show masses, and there'd be masses in the hilum or around the lymph nodes here.
Do we have any evidence here that Mrs. Adamson's doctors ever found cancer in her mediastinal or hilar lymph nodes?
We don't know.
I want you to assume the jury has heard that Mrs. Adamson likely had cancer here. Is there any evidence of that?
We don't. I didn't see any evidence showing that.
How common is it for primary lung cancer to spread to the lymph nodes or the perineal area without first going through the mediastinal or hilar nodes?
It would be unusual.
Would you say very rare?
Yes.
How often do gynecological cancers go to the perineal area?
Well, the gynecologic tract is right here, right adjacent to it. These are the ovaries, and this is the uterus, and this is the cervix. And so they're adjacent to it, and they would drain into those lymph nodes.
How often do breast cancers go to the perineal area?
Less frequently, but they can, because breast cancers can move along the lymphoid chain. These little green things here are lymph nodes all the way down here, but they would also be here as well in the mediastinum.
Do gynecologic cancers and breast cancers go to the perineal area much more commonly than lung cancers, primary lung cancers?
It's more common.
Did the doctors also find cancer in Mrs. Adamson's brain at some point?
Yes, and that's what they were treating in March.
Is the brain a place of metastases for a lot of different types of cancer when there's widespread metastases?
Well, if there's widespread metastases, tumors can go anywhere, yes.
Based on this metastatic pattern, is it a possibility that Mrs. Adamson had breast cancer?
It's possible.
And based on this metastatic pattern, is it a possibility that Mrs. Adamson had a gynecologic cancer?
Yes, it is.
Can you have a large gynecological tumor that goes undetected?
You can have tumors within the pelvis and in the abdomen get large because you can grow larger tumors there that wouldn't have any signs and symptoms, because in other areas there's often compression so that the tumor cannot grow that large without causing signs or symptoms. But in the abdomen and pelvis, there's more room to grow, so you can get very large tumors. And some women with ovarian tumors can have tumors that are 100 pounds and weigh, be 20 to 30 centimeters in large, like this large.
Can large breast tumors go undetected?
Yes, depending on the size of the breast.
How often have you seen a breast cancer first diagnosed by metastasis to the lung?
I've seen it occasionally, so I have seen it.
Is lung a possibility for the primary site here as well?
It's possible.
Can you say Mrs. Adamson's cancer started in any one of these sites to a reasonable degree of medical certainty?
Well, I think there's a lack of evidence to be able to actually ascertain that, so no.
And you said earlier that your opinion in this case is that the diagnosis would be a cancer of unknown primary. Is that a real medical diagnosis?
Yes, it is.
Were thousands of people diagnosed with cancer of unknown primary in the 1990s?
Yes.
All right, Dr. Robb, thank you. You can return to the stand.